She did an ultrasound scan, and the scan showed that her endometrium is within 18 millimeters. She's asking herself, when the ultrasound scan report says that her endometrium is within 18 millimeters, is this normal? Can this indicate endometrial hyperplasia? In this video, I'm going to answer this question. Mukwano gwaffe yakoze scan, ultrasound scan tugiyite ka TV, ne yalaze nti endometrium ye oba kana akabubi ak'omundu omwana ke yeekwatako n'akula kazimbye kalimu 18 millimeters. Alikwebuuza kino kitegeeza ki? Kiyinza okutegeeza ekirwadde kye bayise endometrial hyperplasia. Nkwaniriza ku video yaffe ne yaleero omusawo Gerald Massa the fertility coach gemanya gange era nawe buzeebuuzo mu comments nja kuba nkuddamu. So I'm called Gerald Massa and I'm a fertility coach. I can answer all your questions in regards to fertility. If you have any questions related to fertility, kindly feel free to ask your questions in the comments below, and then I'll be able to answer your questions just as I'm answering this question. Endometrial thickness of 18 millimeters after an ultrasound scan. First of all, we shall begin by talking about the measurements of the endometrium. The measurements of the endometrium keep changing along the menstrual cycle as the menstrual cycle is progressing. Depending on which particular phase of the menstrual cycle, the endometrial thickness will actually change according to the menstrual cycle. If a woman has just finished her periods, if she is in what we call the proliferative phase, the endometrial thickness is going to vary within 2 to 4 millimeters. When a woman enters her ovulatory time, her ovulatory period, or when a woman goes into ovulation, normally this also depends on the length of your menstrual cycle as a woman, the endometrial thickness is going to vary between 8 millimeters to at least 15 millimeters. When a woman finishes her ovulatory period and she's due to see her periods, still the endometrial thickness is going to change. So, kyembadde ngamba kiri nti omukyala wabanga abadde alikwebuuza endometrium eno ezimbye oba tezimbye, endometrium eno oba kana akabubi ak'omunda munabaana omwana ke yeekwatako n'akula ke bayita ka endometrium kakyukakyuka okusinziira ku stage eya menstrual cycle oba kakyukakyuka okusinziira ku cycle ey'omukyala. Oyinza okukola measurements ne ziraga nti oba oyinza okukola scan n'eraga nti endometrium omuli ezimbye ennyo oba nga tezimbye ennyo naye nga kisinziira ne ku stage eya menstrual cycle yo nga weeri. Oba wakava mu periods gwe ng'omukyala, endometrium eno obunene bwayo bugenda kubeera between 2 to 4 millimeters. Oba ng'oyingidde mu kiseera ekya ovulation egenda kubeera between 8 to 15 millimeters. And then of course w'omaliriza ovulation era still ejja kukyukakyuka okusinziira ku measurements eziri recommended. So I was saying that the endometrial thickness changes according to the stage of your menstrual cycle. Our friend said that she did the ultrasound scan and it showed that she had a thickness of 18 millimeters. 18 millimeters. Remember, I said that the normal when a woman is in her ovulatory time is supposed to be at least 8 to 15 millimeters, and now she scored 18. When we say the maximum is 15 millimeters and you go to 18, this actually means, or this actually indicates that the endometrium is actually very thick, it is very big, it is very bulky, and this is what we call endometrial hyperplasia. Mbadde ndi kugamba nti mukwano gwaffe yagambye nti baamukozeko scan n'eraga nti eyiye erimu 18 millimeters, n'engamba nti we tuba tugambye nti normal erina kubeera between 8 to 15 millimeters. Ye n'aba ng'alina thickness eya 18 millimeters, kiba kitegeeza muli munda muba mwazimba. Kino kye bayita endometrial hyperplasia. You might be asking yourself, Gerald is talking about endometrial thickness of 8 to 15 millimeters, 2 to 4 millimeters when a woman has just finished her periods. What is the significance? What is the role? Or what is the usefulness of the endometrial thickness in regards to fertility? How useful is the endometrial thickness in regards to fertility? I'm going to answer this. Mukwano gwaffe ayinza okuba nga alikwebuuza naye kati musawo Gerald alikwogera nnyo ku endometrium, naye mu bintu bya fertility eyamba ki? Endometrium yongayo eyamba ki mu bintu bya fertility? Esobola okulemesa omukyala okufuna olubuto oba nedda? How useful is the endometrium in terms or in regards to fertility? Now we know very well that when the egg has been ovulated, when ovulation has taken place and the egg has been released, it's going to be received by a particular part of the fallopian tube, which is finger-like. It's sort of like fingers. It's going to receive the egg, and specifically, this part of the fallopian tube that receives the mature egg is known as the fimbrial part of the fallopian tube. When this dominant egg, the mature egg, settles in a particular part of the tube, which is actually known as the ampullary part of the fallopian tube, also known as the ampulla. This egg is going to sit there and wait for the sperms to come in and then do the whole process of fertilization. After fertilization, the fertilized egg, also known as a blastocyst, also known as a morula, is going to actually move backwards through the fallopian tube, assuming that the fallopian tube is healthy. If the fallopian tube is blocked with fluids, with scar tissue, then that fertilized egg most likely could remain in the fallopian tube, and this could actually lead to an ectopic pregnancy. But assuming that everything is okay in the fallopian tube, the fertilized egg is going to move backwards through the fallopian tube up to the wall of the uterus, up to the inside of the uterus, up to the endometrium. When this fertilized egg reaches the endometrium, assuming that this particular lady is in her ovulatory time, the measurements, remember I've just said that they are supposed to be 8 to 15 millimeters. Now, it so happens that if a woman is having a measurement or an endometrial thickness of 18 millimeters, then it's actually going to be very difficult for this fertilized egg to implant onto the wall of the uterus, onto the inside of the uterus. So, an endometrial thickness of more than 15 millimeters, maybe it is in 18 millimeters, it's in 20 millimeters and above, maybe even 25 millimeters, makes it difficult for the whole process of pregnancy to happen. It makes it difficult for the fertilized egg, which is known as the blastocyst, to attach onto the wall. So, a big endometrium, a very thick endometrium, prevents pregnancy from taking place. You might ask yourself, how does this happen? What is the physiology behind? How does the thickness prevent pregnancy from happening? Assuming that probably maybe this is a wall of the inside of your uterus as a woman, basically an analogy. So if the egg comes, assuming that this is an egg, it comes and then it attaches itself onto the wall of the inside of your uterus. It's supposed to do what we call burrowing. It's supposed to dig. If I told you ever done farming, or if you visited a garden to really see how planting of seeds takes place, and specifically cassava, if you actually do, if you are farming and then you plant cassava in the soil, the cassava is going to dig deep into the soil, is going to dig deep in the process of looking for nutrients, in the process of looking for water from the soil, and then of course once it gets all those nutrients, it will be able to grow, and then you'll notice that the cassava will come out of the soil and then it will actually be visible. The leaves will be visible, but the real cassava will be embedded into the soil. That is actually a mechanism that is similar to what I'm trying to describe. When this is the wall of the uterus and then this is the egg that has come and it has attached itself onto the wall of the uterus, it's going to begin to dig, okay? Just as you see cassava digs deep into the soil. So it's going to begin to dig. This is a fertilized egg digging inside. The whole process of digging inside the wall of the uterus is what we call burrowing. In Uganda, we call it oxima. So it will dig, and then of course, in the process of digging onto the wall of the uterus, this baby, as they are trying to look for a place to attach themselves, there's going to be some blood vessels that are going to rupture. We call this rupture of the lacunae. So when these blood vessels that are embedded onto your wall of the uterus rupture, then there's going to be some little blood, there's going to be some little bleeding, some little spotting. We call this implantational bleeding, we call this spotting. Now, if the endometrium is within 8 millimeters to 15 millimeters, that process of digging will take place very easily. If the thickness is above 15 millimeters, okay, it's maybe in the 30 millimeters, 25 millimeters, that process of digging will not take place, and the end result is going to be washing out. The fertilized egg is going to be washed out, one of the leading reasons as to why many women experience repeat pregnancy losses. Let me answer all your questions in the comments, and remember to join my fertility lessons on WhatsApp. The numbers are over here. Join me and then learn about your fertility. I'm called Gerald.